Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Preparing the action plan. Once you're clear that tobacco contains nicotine, that this is the main cause of dependence, that it is harmful to your health, that you're a drug addict, and knowing the benefits that quitting smoking can bring you, we are going to establish a plan of action for this. First of all, we are going to calculate how much you smoke and how much you spend on tobacco. Self-observation. Do you want to know how many times you have made the habitual gesture of lighting up a cigarette? It is very easy and you will be surprised to know the result. All you have to do is to do the following operation. Determine the usual number of cigarettes you smoke per day. Multiply this figure by 365. Total number of cigarettes per year. And the result by the number of years you have been smoking. Total number of cigarettes smoked since you started smoking. That's a lot, isn't it? Once you have done the calculation, you will know how many times in your life you have repeated the habitual gesture of smoking. And with this, you will understand why it has become an automatic act, firmly and unconsciously associated with many daily activities. With this operation, you can also calculate how much money you spend a year on tobacco. Thinking about the possibility of living normally day to day without cigarettes causes you a feeling of emptiness, of loss, which you doubt you can overcome. It is normal to feel this way because you have developed a strong psychological dependence on tobacco. But you should know that it is possible to go back to living without tobacco. You can do it. You have probably done more difficult things in your life, and you should know that as soon as you achieve your first success, you will feel a great sense of satisfaction when you realize that it is possible to go back to living without tobacco. You will feel a great satisfaction in knowing that you really can do better than the cigarette. Or are you going to let yourself be defeated by a small cylinder of white paper filled with tobacco? Don't try to get rid of something that has been part of your normal way of functioning for so long. Smoking has become part of your very way of living and relating to your environment. Moreover, as we have seen, since you started smoking regularly, your body needs more and more tobacco to function. You are hooked. So, if you want to quit smoking, don't rush into it. Quitting smoking requires a process to retrace the path that you repeated and repeated smoking has taken you down. If you want to regain the freedom you lost by smoking tobacco, at the beginning of the journey, you must retrace your steps, and this requires taking firm steps to achieve your goal, step by step. The first steps on this path consists of knowing what tobacco gives you. Be very clear about the benefits you will obtain if you quit. Knowing what your dependence on tobacco consists of. Know how you can overcome your dependence. Recognizing the many satisfactions that quitting smoking will give you and being able to enjoy them. In short, it consists of analyzing the advantages and disadvantages of smoking with the many benefits of quitting. The record. Once we have analyzed with the Fagerstrom test how much you smoke and in which situations we check your level of addiction to tobacco. As you know, you often smoke automatically, almost without feeling like it. Tobacco use is associated with everyday situations and actions. Try from now on until the date you decide to quit to be conscious of the acts of smoking and only light up a cigarette when you really and truly feel like it, and above all, when you think you're going to enjoy it. In this way, we try to break the automatism of smoking, thereby taking away many more cigarettes than you think. Take the test. Add up all the points you get for answering each question in the test. You can score between 0 and 11 points. The higher the number you score, the higher your nicotine addiction levels will be. Scores of 4 or less indicate that you have a mild addiction. If you scored between 5 and 6 points, your addiction is moderate. If the result is 7 or more points, you have a high dependence. Smoking is a highly automatic habit. You routinely perform the act of smoking in many daily situations. Before eating, after eating, when you have nothing to do, also out of boredom, when you are very nervous, when you are at ease, when you talk to other people. That is, at all times, in any situation, smoking has become omnipresent in your life. Preparation phase. At this point, you must set a date to quit smoking. Whatever the amount of tobacco you use, it will always be more dangerous and more harmful than not smoking at all. There is no such thing as a harmless amount. It is a fallacy to believe that smoking only 5 cigarettes a day is practically equivalent to not smoking at all, and many believe this lie. Just like believing that drinking a glass of milk in the evening cleanses our lungs. Too much or too little tobacco is always bad for your health. Many smokers delay their decision to quit because they think that the damage has already been done, and they believe that quitting will not help. This is not true. Once you have made the decision to quit, you're ready to choose a date. This is a very important step. Choose a specific date in the next month as your quit day. If you choose a long-term date, this will give you time to think and change your mind. However, it is good to take the time to prepare and make a good plan. You can choose a date that has special significance, such as a birthday, anniversary, etc. Or just pick a date. Circle the date on the calendar. Make a firm, strong, personal commitment to quit on that date. On the date you set yourself to quit smoking, it is to quit completely. You can't do it. Willing is able, and you want to do it. Setting your mind to cut down on cigarettes is useless, because you will go back to smoking as much or more than before. It only works if you take action to quit smoking completely. A couple of weeks before your quit date, you should keep track of your cigarette consumption. Don't try to cut down, just mark each cigarette you light up with a cross. This exercise will help you to be aware of how much you actually smoke, in what situation you smoke, and above all, it will be very useful to help you to de-automize your smoking behavior. You have 3 columns. In the first column, starting from the left, you have the days of the week. In the second column, you should write down the cigarettes smoked. In the third column, you will write down the situations in which you light up and the reason why you do it. Now you're more aware of how much you smoke per day, in which situation you smoke, and why you smoke. If you're interested to continue learning about clinical hypnosis, watch our next video, Recommendations Prior to Quitting Tobacco. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks. If you have questions, add them in the comments area about this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.